Good morning, and thank you all for joining us for United Rehabilitation Services' first town hall meeting. And we love this virtual opportunity to reach out and share a little information with you all about how we've been doing and where we're going. But I know we've received a few questions in advance, but feel free to go to the Q&A box at the bottom and you can chat us whatever questions you have while we continue through this process. I'm Dennis Grant, the Executive Director here at United Rehabilitation Services, and we are very pleased to be able to provide this update. You know, we care deeply about the hundreds of kids and adults with disabilities that we serve every day. And in late February, we began really analyzing what the future might look like in terms of the COVID-19 pandemic, and spent several weeks really agonizing over our decision as to whether to close the facility or how to best handle this in a safe manner. We knew that this was going to have a tremendous impact on the people we serve and their families, so we took a lot of time to make that decision. But frankly, we decided to close on March 16th, even before the governor's order to shut down adult day programs and child care centers. And we took this very seriously, but knowing our history of being United Cerebral Palsy and the many people that we serve, including seniors with underlying medical conditions, we knew that this was something we needed to do at that time. It's actually been quite an experience for us working with families, surveying them to find out what their needs were, providing them with diapers and wipes and cleaning supplies, whatever we could do, but also to develop a plan for how can we renew services as soon as possible in some way, shape, or form. We spent a fair amount of time doing this, and we were able to open again for center-based services on April the 6th, but on a very limited basis, just to provide some small group activities for adults who were in greatest need and support their families, but also for childcare. And we became a pandemic childcare provider with a temporary license under the state of Ohio. This allowed us to serve essential employers and their employees, and some of whom were actually prior enrollees here in our childcare program. This was very exciting for us, and it included the opportunity of adding telehealth services and therapies. Our childcare program has grown a bit, and we now have 4 classrooms open, 1 infant toddler, 2 preschool, and a school-age classroom. You know, we've been able to provide a lot of services to those individuals who are Head Start and early Head Start recipients, supplying them with formula, pull-ups, wipes, and diapers. So in addition to the childcare we're providing, we've been able to continue to support families at home. But we're doing this under the restrictions provided by the governor's reopening of childcare. The Responsible Restart Ohio really limits us to no more than 6 children in the infant and toddler ages, and no more than 8 or 9 when we get to the point where we actually open on June the 1st. So we know that although we normally would serve approximately 90 children, our maximum at this point, even with 4 additional classrooms opening, will be less than 60. And that doesn't take into account the fact that our summer camp program would normally bring an additional 20 individuals in. So this has been a real challenge for us. Our adult day program has been operating. We now have 3 small groups operating right now, and we're limited to no more than 8 individuals with 2 staff. Now, we've gone to great lengths to identify how we can provide the safest environment by bringing those individuals in on the same vehicle, sanitizing those vehicles after each use, but they have their own separate entrance for each group, their own separate restroom facilities, and the staff stay with them throughout the day. So there's no crossing over of groups, no mixing of those individuals with others. And basically, we can provide that all in a self-contained space. We do hope to be able to realign some of those groups and add a 4th group. We've actually been approved by the state of Ohio for up to 32 adults at this point in time. Now, bear in mind that normally our daily adult attendance is 177 in February of this year. So we are significantly under what we would typically expect to be providing for people. Because we have so many individuals who do have underlying medical conditions, and it would not be safe for some of them and our seniors to attend in a center-based program, we have been providing virtual programming and what's called on behalf of services, where we actually deliver activities and materials to their homes, as well as cleaning supplies, personal care equipment, those kinds of things. But our virtual programming has included not just arts and educational activities, but also some vocational programming and even instructions in how to use personal protective equipment. This has been something that I think has been really important, because it's not just helping people to practice those same safe and healthy behaviors here, but how can we help them carry those over into their homes and the community? Now, we also began providing telehealth therapy services on April the 6th, and that has allowed us to serve over 100 patients while they're in their homes with occupational, physical, and speech therapists. All 6 of our therapists have been actively working with their patient caseloads and scheduling them for treatment throughout the week. And we've gotten some very positive feedback on this, and we're very pleased that we've seen progress in those children and even the adults we've been serving virtually. So this is something that we hope to actually be able to carry forward into the future. As of June the 1st, we will be opening up our therapy clinic here at United Rehabilitation Services with some fairly restrictive protocol in terms of how we can accept those children and adults into our area. Patients' families will have to wait in their car in the parking lot. We'll deliver them to the therapist. We will make sure that we screen every individual child and their caregiver before we accept them into the building, which is the same protocol we use for every adult and child being served right now as well. Even in childcare, those parents are now delivering their children through the entrances from the playground. So none of the parents actually are able to enter the building, and no visitors or volunteers have been allowed in as well. So we have done everything we possibly can to make sure that this is the safest environment possible for those individuals. Now, the one area that we did not ever have to close was our employment services program. And employment services was able to continue to provide some opportunities for individuals with job seeking skills training, job development, and job coaching, all done remotely. The technology has allowed us to really support those individuals even on the job, and we've maintained our relationships and communications with employers and actually been able to find jobs for some of our clients with essential employers through this period. We are looking to add our summer youth program, providing foundational basic work skills training, career exploration, and hopefully by the end of the summer, some community-based work experiences. But that will all be contingent upon how things progress with the reopening of Ohio. But we're very excited about the fact that we've been able to support some of those high school students with pre-employment training services during this period, and now we'll be able to get them into the community and hopefully by this fall be able to help them move forward in their development. All of this is only possible because of the fact that we have been able to successfully raise tremendous amount of funds to cover the funding gap, the difference between what it costs to provide the services and the revenue we are able to generate. This has been made even more challenging at this time, since even in childcare, at best, we'll be able to achieve about a 60% capacity, and in adult services, about 20%. Therapies, we hope to be able to continue to grow, and we actually are accepting new referrals for patients beginning June the 1st. But we know that there are going to continue to be challenges. There probably will be some setbacks along the way. And we certainly know that even our events have already been impacted, with the Jersey Mike's event really being canceled, With other events we know and opportunities to sell ducks, our biggest rubber duck regatta, our biggest event of the year. We know that the German Fest and other festivals where we normally sold a lot of ducks had to be canceled. But we are moving forward and we do need your support, and we're still seeking sponsors for the Rubber Duck Regatta through the mid-June. That event is scheduled for September the 19th, and certainly this is an opportunity for you to get the biggest bang for your buck as well, because the same promotions, the same activities will continue. But we really do need your support right now. You know, we've seen tremendous losses already in the first 2 months since the first shutdown. And although we are going to grow programs, we know that this will never be back to where it was for some time. We do have $50,000 in challenge matching funds. So for every dollar donated for the next several weeks, we will be able to match those dollar for dollar. So we hope that you can lend us a hand and give us some support at this time. It's truly a challenge for us, and we know one we can overcome. I know to some degree it may sound a little trite, we hear it over and over again, but together we can make a difference. And we hope you'll join us and be a part of that. Now, we did receive a few questions. Let me take a look here. So you can still go to your chat also, please, to go ahead and submit questions versus the Q&A. But you can also see in there, there's an opportunity for you to go directly to our website and make a donation today. Let me not forget that. But what have been the biggest challenges in terms of your pivot to pandemic care? Well, pandemic care, whether for children or for adults, has required that we spend an immense amount of time planning for how to conduct these services in a safe manner and keep everyone healthy, both the individuals we serve, their families, as well as our staff. You know, what keeps me up at night is worrying about the fact that if someone were exposed, what impact might that have on the entire group? And what might we have to do in terms of closing down that entire classroom for at least a period of time? The new pandemic childcare rules basically require notification not just of Job and Family Services or the state of any incident such as that, but also the health department, who will actually dictate our actions from that point. But we have worked very closely in looking at the guidelines from the CDC, the Ohio Department of Health, and many others to make sure that we are implementing all of the best practices possible. The Montgomery County Board of Developmental Disability Services has been very helpful to us and supportive with supplies and equipment, and even helping to supply meals for our clients. And you know, I think they've been very pleased with the efforts that we've put forth, and they feel like we have really set the standard. We are the only organization providing center-based adult day services at this time in the area. The next question, what does the future look like for both childcare and the new mandates for adult programming? Well, as I mentioned, we continue to be restricted in terms of the size of groups. The federal guidelines as well as local guidelines are no groups of larger than 10. So we can either have in childcare for our school age and preschool children, 8 children and 2 staff, or 9 children and 1 staff. And because they all have to be segregated into different groups, we're really restricted based upon the number of rooms that we have. When will we get back to normal? Well, we certainly hope that at some point that will go from a maximum size group of 10 to a maximum group of 20 or even 50, where it was once a couple of months ago. When do you expect to get back to full capacity? Well, you know, I don't think anybody has a crystal ball. I know I watch the news morning, day, and night, listen to the governor's statements and Dr. Acton. But, you know, at best, we need to find a treatment for this virus, and we need to see a vaccine that we know will help keep individuals safe. Is that a year from now? Is that 2022? We had just started our strategic planning process for 2021 to 2023 when all this broke. And we've really put that on hold because no one knows what the future truly will look like at this point. But we're very optimistic. We will be here to meet the needs of the individuals that need us, whether virtually or in our center. Here's a question. To whom would we send funds, or how can we drop the funds off? Well, certainly you can go to our website at www.ursdayton.org, or you can certainly call us and make your donation over the phone. We are not allowing people into our building, so if you would choose to drop something off, we would have to arrange to meet you in the parking lot. We do require not just all staff, but anyone near the property or at the doors to wear masks, so please come prepared for that. But you can certainly call us and make arrangements if you have any questions. Certainly feel free to mail us a contribution, but online donations are certainly the easiest for most. We have another question. How do you keep the kids separated? Well, Governor DeWine really deliberated over when to open childcare again for some time, mostly because we know that children and many of our adult clients, it's hard to keep them separated. We know they're used to being with their friends, and changing that kind of behavior is very difficult. We can talk about social distancing with children, but it's very difficult to achieve. We have lots of space in this building that we currently are not even using. We bought sprayers and foggers, and we hope to be able to open up the gym and some other areas. But for now, they're confined to one classroom all day. We sanitize everything in the evening thoroughly. We clean the entire room and everything in it. We clean the playground equipment. And we're able to make sure that the place is clean and sanitized every morning. Through the day, the staff are responsible for doing sanitization of all toys and materials. Anything that cannot be cleaned on site is put into a basket and separated from the classroom so it can be cleaned at evening. So we've really tried to find a way to make sure that those kids are safe and healthy. We know in the infant toddler areas that children like to put things in their mouths, and there's a lot of touching that goes on. But for any of those surfaces or materials that are touched a great deal, we're constantly cleaning and separating those as much as possible. We have a question that says, will we have summer camp? Well, summer camp will not occur as it typically would. We do have some school-age children who actually are already enrolled through our pandemic essential workers group, about half of which do have disabilities of one type or another. We will continue to enroll some kids for the summer, but again, we're very limited. Right now, we only have one school-age classroom for 8 children. We're actually exploring the possibility of dividing those rooms up. We do have room dividers, but we'll have to make other arrangements for changing tables for those who would not need a restroom. And we would have to get a portable sink for hand washing and sanitization. But we are looking at opportunities so we could at least get to 16 school-age children. It's a real challenge having to have a separate entrance and separate restroom facilities for each one of these classes. They can't go into the hallways. We can't use public restrooms, so it's very restrictive. But please, if you're interested in summer camp services, please contact us right away because we are very concerned we will be full before you know it. Here's a question. Do we understand how future funding and support levels from the state and county will be changing? Well, we've been very fortunate. We would have experienced much greater losses had it not been for the fact that the Department of Job and Family Services has continued to subsidize childcare for those children who would normally be covered under Job and Family Services subsidies. We have continued to receive the full amount that we would normally have gotten based upon average billing recently. We've also continued to receive Head Start and Early Head Start funding, as well as money from Preschool Promise. Once the governor's order for June the 1st of reopening childcare happens, those subsidies will basically go away from Job and Family Services, which is over $40,000 a month. We will also see, in all likelihood, a reduction in Head Start and in Preschool Promise dollars this summer. We will go back to regular billing. We will have some additional absence days for children who are sick, and potentially even pandemic absence days if the child is out because of COVID-19, either them or their family members affected. For adult services, we received 2 weeks of subsidies back in March, but nothing since. You know, if you look at our adult services revenues, they're down about $100,000 a month. Now, fortunately, of course, some of our expenses have been down as well. But the losses we expect will begin to pile up at this point, because when the subsidies go away, the funding gap is only going to grow. But we're very fortunate that we're actually in a good position at this time. We will continue to expand services, and we have great hopes for the future. But once again, you know, we can only do that with your support and the support of the rest of this community. We thank you for joining us today. I hope that was helpful information to you. Please do not hesitate to email, call, reach out, and let us fill you in on anything else that you didn't get a chance to ask today. We certainly appreciate all that you've done so far and all that we know you'll do in the future. Thank you so much, and have a great day.